Good evening and welcome. This is Open Mic. I am your host, Reese Waters. Here on the show, we usually start the show with jokes, but as I always say, I am from Prince George's County and I live in DC and got a lot of love for VA. And like you, I care about our community. And as a community, we need to get comfortable talking about the uncomfortable. Like this simple fact, there is a stigma around HIV and AIDS. One of the biggest reasons, people aren't having enough open and honest conversations about the issue. And that's why tonight, in partnership with Prince George's County Health Department, we're doing something a little different in honor of World AIDS Day. We'll take a look at the facts and stats about the HIV and AIDS epidemic and why it's hitting us so hard right here at home. Then I'm going to pass the mic to experts and some of those living with HIV to hear straight from them about how we all can be allies in crushing the stigma surrounding HIV. And I drop the mic and discuss how to have the sometimes uncomfortable conversations about HIV and AIDS with your loved ones. Now, let's start with the facts. The entire DC region has been hit hard by the HIV and AIDS epidemic. But Prince George's County has been one of the most impacted jurisdictions in Maryland since the very beginning. In 2013, Prince George's County surpassed Baltimore City for the highest number of HIV diagnoses. It continues to have the highest number of new diagnoses in the years since. At the end of 2020, there were an estimated 9,200 people living with HIV in Prince George's County. And by the way, nearly 1,200 of those are undiagnosed. That means about 1 in 8 Prince George's County residents living with HIV don't even know they're positive. Just let that sink in for a second, because these aren't just stats. These are all people, and many of them people of color. Of those diagnosed as HIV positive in Prince George's County, 83% were Black and 8% were Hispanic. Once again, 83% were Black and 8% were Hispanic. 68% were male. Now, I know I'm tossing a lot of stats at you, but this is very important. And we haven't had this conversation enough. This isn't just a young person problem. People between the ages of 40 and 59 accounted for half of those living with diagnosed HIV. And it's not just an issue for our LGBTQ plus friends. Although male-to-male sexual contact accounted for 48% of infections, heterosexual contact accounted for 41%. Now, addressing these problems starts with two things: having conversations with the people you love to remove the stigma surrounding HIV, and getting tested. Be comfortable talking about a virus that makes people uncomfortable, and know your status. Now, when I say I care about this community, that's not just a setup for a punchline. I really do. Which is why deciding to spend the next 30 minutes doing what we can to remove the stigma and shine the light on a seemingly forgotten epidemic that's affecting people I love was a very easy decision. So for tonight's Pass the Mic, we're bringing in the brightest minds in the area to teach us more. We understand the facts of the problem. Now we want to focus on how and why we got here. And to do that, we have an excellent panel of 4 experts to discuss. Karen Holmes, a transgender woman and advocate for the community. She currently works with Prince George's County Police, helping get sex workers off the streets in the Fairmont Heights area. Linda Scruggs, she was diagnosed with HIV and, more importantly, has lived with HIV for 31 years. She's now a community voice and advocate based on her experiences. Diane Young, a registered nurse who works for the Prince George's County Health Department. She got in this fight about 20 years ago when she lost her brother to AIDS. And Dr. Carlos Rodriguez Diaz, an associate professor at George Washington University's Millikan School of Public Health, who's been studying the disease for 20 years. I want to thank you guys so much for being here. And the numbers show extremely high rates of HIV in young LGBTQ plus Black men as well as other minorities. So my question, why does it affect these groups of people so much?
I'll take the first stab at it, Reese. It's really around the stigma associated with HIV. Even just being tested is stigmatized. So if you can't even get tested without feeling a certain way, how do you even get treated once you find out that you're HIV positive? And trying to get people into care once they're HIV positive to combat that stigma around being HIV positive is always a challenge. And our young LGBTQ community often goes underground because they're stigmatized and they're judged. And we need to get away from that.
If I can just add to that, I think also, it's the stigma, but also when you think about other minority communities, HIV has been stigmatized since the beginning of the epidemic. So myself as a heterosexual Black woman, making sure that people are not ignoring, what's happening. It's easier often to not address versus to address that HIV is in our community. It's in our community for a moment, but we can stop it. Stigma is a big piece, but also just lack of information and lack of self-identity. Part of my reason of coming out was to tell a story. I don't look like what I've been through. I don't look like someone with HIV, but because it's true, I also know that other people look in the mirror and think that they're not talking to me. They're not talking about me. So I think it's easy because we also come from a lot of other issues and trauma space as Black and Brown communities and health disparities. So HIV is just another one of those health disparities that we're challenged with in our community.
And I know that the community, at least in the transgender community, a lot of people are assuming that that is a big issue right there in regards to HIV. You've got the sex workers that are out there working, and a lot of times people are thinking they're not being really that safe out there as far as having condoms on or not really doing it at all. I think we just need to really get the understanding of why the sex workers are out there and that to see it in a different view of things right now.
When you guys talk about the stigma and trying to defeat the stigma, that makes my mind go to two places, one of which is trying to get people the information and the truth and the realities that are involved with HIV and AIDS today. The other is about that perception. And as somebody that's a part of the media, I kind of take that part of it and try and own that part of it and how you can go ahead and change that perception in order to combat that stigma head first. And I feel like doing programs like this is one part of it. What more can we do to combat that stigma?
There's a racial justice piece here, right? So where HIV has been allowed to be. The African American Latina community, we're taking the brunt of this epidemic right now. Many of our folks are still thinking that it's someone else, but it really is. And race impacts that. Access, our zip codes, community, education, the social determinants of health are all inputted. And again, African American and Latina descent individuals take the brunt of that. So it really is looking at structural racism. It's looking at structural change and implementation, and also noting that one size don't fit all, whether we're talking about stigma, whether we're talking about treatment, whether we're talking about access to care and services.
And HIV awareness is extremely important. It should be in all conversations, all health encounters. Primary care providers have a very important role in opening the door for people to know about HIV, know their status, and then to stay engaged in care. And finally, I believe that we need to understand that we are not unidimensional, right? We are many things. We are man, gay, person of color, living in a particular place. And with that understanding is that we need to respond to the epidemic. So we work from racial justice, from LGBT equity, and for housing security, for food security, because all those elements influence how people interact with the world, including their health experiences and the healthcare system.
There are also a lot of people in and around DC and Prince George's County that are not in care, that they know their HIV diagnosis, they know their status, but some of these other structural things still keep them out of care. So I think part of what we're trying to say that care is available. You can live limited life expectancy with HIV. You don't have a limitation of life space. And I think that that's scary to people who still think that this is a death space. I love telling people that, it's been 31 years. The doctors were wrong. They gave me 3 years, and they were wrong.
And I'm so glad they were. We still have more from our outstanding panel. Right after the break, we dive into how racial inequities make canceling HIV tougher and lay out exactly what you can do today to help our community. Now, we know we threw a lot of information at you in the last 10 minutes, so we want to make it easy for you to get everything you need. Just text CANCEL, CANCEL, to 202-895-5599. We'll send links to resources from Prince George's County Health Department right to your phone, including how you can find HIV testing where you live. We can all do our part to help cancel HIV and end this epidemic.
A socially conscious special, sponsored by Prince George's County Health Department.
Now, we want to get back to our panel discussion about the HIV and AIDS epidemic going on right now in Prince George's County. Here, we get into how race plays a factor and what we can all do right now to help. You mentioned the idea of there being a racial component to this, and I wanted to key on that aspect of it as it relates to the stigma and as it relates to perception, because when we want to have the conversation about societal injustices and racial inequities, that's a conversation which we have often with respect to many things, but specifically with respect to healthcare, that has been a line which we haven't really as a community crossed and accepted that there are some realities of treatment that we can take advantage of that we're not, and there's also some realities of what is currently facing our community that we're not facing. That's just part of this conversation we're unwilling to have for whatever reason.
When we talk about healthcare, right? And I talk about being a Prince George's County resident. If I was anywhere else if I was not in a space at the time where I was uninsured, because of where I live, because of my upbringing, I would have never been offered an HIV test. Based on my sexual history, I wouldn't have been offered it. But because I found myself in a public health clinic uninsured, it was automatically something that was a checklist to happen. The clinic was surprised and I was surprised. We often find, particularly among Black women, many of them are not part of the checklist space that we're looking for HIV. And why is that? That's a problem when we talk about race. We talk about insurance, and, Dr. Diaz talked about primary care providers. adolescent care providers. We're testing at the DMV, but are we educating at the DMV? Every place we intersect as Black and brown people, we should be talking about HIV in our untraditional houses of faith, houses of worship, synagogues. We have to be having real conversations because that's where the real people are. They're not necessarily knocking on the door of the HIV service organization. We have to go into the community because, again, doors have been shut. It's no secret that the oppression that Black and brown people have experienced across all sectors of health, life, and breath, right? So if we know that they won't come, we have to create opportunities to allow them in, but also show up where they are, where they live and where they breathe and where they shop and where they use their resources.
As far as the transgender community, the and let me really say this from the start because it's very dear to my heart. When we transition to be happy, and because of the way society treats us, we ended up losing our spouse, our children, our homes, our friends, our job. And our job is where we can get that insurance to cover a lot of things that we need to do. And a lot of times when we lose that, a lot of the girls and guys they lose that insurance and then they end up going to the internet to get them off the web. And that's very bad, especially if somebody has a chronic disease such as high blood pressure or diabetes, all of those things where at least when you go in to a doctor, they're going to do blood work on you. They're going to give you the kind of medication that you really need to control that level. And if you don't have the insurance, you're just going to end up getting that stuff from somebody on the street or, like I said, on the website. And that's very bad. We need to be able to reach out or have some kind of service where these trans people out on the street can get the services they need to stay healthy and safe out there. Everybody really needs to reach out and understand what and who transgender people are. And if you understand that, I think you're going to get a better light into who we are, such as we're not what you see on Jerry Springer show. We're military people, we're firefighters, we're nurses, doctors, judges, politicians, actors and actresses. Talk to us and find out and understand where we're coming from. Sex workers out there that are transgender, this is called survival sex because they don't have what you need on your table for food. You don't have a place to lay your head down to sleep. All of these are very important to us, and maybe you can help us so we can be able to combat this HIV thing as well.
What can the people that are watching this show, that are at home, what can they do right now to do their part to help cancel HIV?
Those of you listening at home, think or share if you have had a test for HIV recently, right? You should know the answer to that question. And if you don't, and you haven't been tested recently, well, do it. What we are promoting here is knowledge. And the first step for you to know if you can do something is to know your status. So go get tested. Today is a good day, a good reminder, and many places will be testing, but throughout the year, there are many testing sites. Once you know your HIV status, then you can do something to remain HIV negative or to remain healthy by getting treatment if you are HIV positive. Lastly, if you think that this is a topic that is uncomfortable and that HIV is somehow something that some people deserve, well, let me tell you something. People who know their HIV status are in a better position than you, and they're doing something about their health. So think about that.
I want to say thank you again to Karen Holmes, Dr. Carlos Rodriguez Diaz, Linda Scruggs, and Diane Young. Coming up next, we spotlight an organization dedicated to canceling HIV, but making it a good time. Yeah, let's give some love to people in the community doing their part to fight the HIV and AIDS epidemic. This Brunch and Babes Drag Brunch from a couple weeks ago at Johnny Pistola's raised money for Impulse Group DC's Mental Health Fund. The group helps LGBTQIA plus people get mental health services. And as you can see,
my mission is to really, advocate, bring resources to the community, be almost like a liaison between the community that needs services and the resources available. A lot of times people don't really access the services because they don't know how.
If you want to know more about the group or the services from the Prince George's County Health Department, head on over to WSA9.com/open mic because we put it all together for you. All right, coming up on Open Mic World AIDS Day, we drop the mic on one of the best ways you can help stop the HIV epidemic right now.
A socially conscious special, sponsored by Prince George's County Health Department.
It's time for the mic drop. I indeed show by going deep on one topic affecting our community in hopes we can all learn a little more. It was in June of 1981 when the first cases were reported here in the U.S. A new disease, acquired immunodeficiency syndrome, arising from the human immune deficiency virus, HIV and AIDS. A perversely dynamic duo which in 40 years has claimed roughly 36 million lives. This number, by the way, comes from the World Health Organization, who rightly see this as a crisis situation, a global epidemic. But as you've heard tonight, we're in a crisis situation right here in Prince George's County too. At the end of 2020, there were 8,014 people living with HIV in my home base, the majority of whom are black and brown. And that's just counting the diagnosed. So we know that there are in fact more then and now, because as we also know, there's no cure, which means that number keeps growing. So the question is, how do we control it? How do we slow that number's growth? Because we can't stop it, not without a cure, but we can damn sure slow it. And I know the numbers look staggering, but they're surmountable. We simply have to start treating this virus the way we do any other, or rather keep treating this virus the way we do any other. HIV has existed in this country almost my whole life and many of yours. We grew up with it in the background. Concerted efforts were made to inform us what it is precisely, the risks and the preventions. Whole campaigns were built around education in the media, in schools, sometimes even in church. We've been educated on it. The myths were laid out and dispelled, and still, too many of us believe it's their disease. It only impacts them, not us. We consider ourselves sophisticated in Prince George's County, but too many of us still look at this virus through the eyes of stigma and shame, when we should see it like any other health concern. And how do we do this? Testing and education. Testing should be a normal part of our lives, even us married folks. Yes, you too, just another part of the yearly physical. Next, conversation. We have to get comfortable with discussing it. That sense of taboo you feel, that's in your head. And finally, we have to look after those of us in the community at higher risk with urgency, respect, and love and resources, because they deserve no less. This is 2021, not 1981. It's our disease. Let's fight it together.